right. Hey, everybody. I am here with Kari Wold, and we are going to talk about her upcoming presentation in October for ADHD KC. Just a little bit, though. Mostly, we're going to talk about what got her here and the things that she likes about what she does and why she's passionate about working with people who have ADHD and other fun neurodiversities and anything else you want to share. So, welcome.
Thanks. Hi, everybody. It's nice to be here, and I'm excited to be chatting today briefly, and then also excited to be presenting here in about a month, actually.
Yeah, less than a month. It's
Or
coming up.
yeah, yep,
Super.
it's coming up quick. So yeah, so I'm happy to chat. But Jeremy, if you have specific questions or things that you think people might want to know about, I'm happy to answer.
Yeah, yeah, absolutely. So let's just start with like just a little brief background. Like tell me about you, how you got to where you are now, what you do, that kind of stuff.
Yeah, so I started in mental health actually back when I was 20, so two
Like
years
last
ago.
year. Yeah, totally.
About 16 years ago, and
Uh-oh.
started in uh, just kind of when I was in college, and found very quickly that I really enjoyed it, and started working with more, I would say, high risk populations. So a lot of people that I would say, unfortunately, are oftentimes viewed as more difficult to work with. So, people coming out of corrections and young women, especially diagnosed with borderline and bipolar personality disorder,
Mhm.
uh, and so, and other personality disorders. And so, I did that for a number of years, and then went on to my master's program, and ended up going into an organization that specialized and worked with autism,
Mhm.
and stayed there for about 8 years, and did a lot of work through that organization, and really specialized in all things autism. But we also know with autism comes a lot of comorbidity
Mhm.
as it relates to comorbid diagnoses of ADHD, anxiety, depression, amongst other things.
Mhm.
Um, and then kind of continued on with that path. I learned a lot through both of those organizations. And then about a year and a half ago to 2 years ago, decided I was ready to kind of shift, and I was in a place in my career path that I wanted to and needed to. So I ended up coming to where I'm at now, and really doing lifespan. And so I do work with individuals as young as elementary and as old as 70s,
Wow.
and in all backgrounds. And so I would say a specialty in autism, ADHD, neurodiversity. And we
Mhm.
know that umbrella has become rather large,
Mhm.
which is great because humans are unique, and the way our brains work, and being able to flow with people and meet them where they're at is so critical.
Mhm.
Um, but then I'm also getting to explore broader areas in regard to diagnoses and working with parents of children who are neurodiverse, and also working with those individuals themselves who are
Mhm.
neurodiverse.
Yeah.
So it's been a really neat journey, but that's kind of what got me here and where I'm at now.
Awesome. What do you like about what you're doing now?
Um, Everything. I do diagnostics here too.
Yeah.
So I love diagnostics. I love talking to people. I love hearing about their world, how their worlds are impacted, the great things they're doing, and the things
Mhm.
that they have a hard time with, so that I can help them figure out how do we make it so that you're not living life on level hard,
Mhm.
and how do you have it so that you feel successful and accomplished with who you are, and how are you accessing the things that make you feel whole, but also allow you to be successful without it being so difficult, because so much of the time there are things that maybe systems wise aren't quite created
Mhm.
that support people the way we need them to support people. So it's how do we access that, and how do we make it more accessible to you? So I love the diagnostic side. When it
Mhm.
comes to therapy, I love getting to talk to people, teaching them and helping them provide tools. I love hearing about their own tools that work for them, and perhaps how do we tweak them to make them more effective.
Yeah.
And then come back in, and hearing about the successes they've had.
Right.
I also like hearing about the failures, because it's really only a failure if you don't try. It's
Mhm.
really more, some of these things are trial and error, and what works for one does not work for all.
Right.
And so how do we find the tools that actually work for you, and how do we grow a big toolbox so that you have multiple tools in your box, so if one day doesn't sound good, you have others to lean on.
Yeah, I love that. I love everything that you just said. I just think it's fantastic, especially about failure too. Because I mean, in my work, like as an ADHD coach, but also when I'm doing therapeutic work too, failure has gotten this negative connotation, and really, it's just another way to try that maybe didn't work. And so we work.
Yes.
I mean, I work a lot with my clients to kind of take the sting out of failure and
Yep.
focus on the process and find out what worked. Even at
Yeah.
home with my kids, we talk about, how did you fail this week? What would you do differently? How did you succeed this week? How did you help someone else? That kind of thing. And I think it's really important to have those conversations because,
Yep.
a lot of us grew up in an age where it wasn't acceptable to fail. And
Yes.
so, particularly as adults who get diagnosed with neurodiversities, at that point, I think a lot of individuals have been pretty hard on themselves and feeling like they failed. And so, working with a therapist or working with a professional who says that, hey, that's not what this is about, I think can be, really life changing. So I'm so glad that
Yeah.
you shared that. That's fantastic. And so you've seen
No.
like a lot of changes over the years. I mean, you've been doing this for what, 15 years now, you said?
Yeah, a little bit over that. So I think I'm actually heading into, I might actually be heading into year 16 or 17, depending on when I started. But yeah, I mean, so definitely at least 15. So a lot of changes, not only in research and understanding of neurodiversity and acceptance of it, but also just tools and resources available.
Yeah, so many more, wouldn't you say?
Definitely more, but still definitely areas that we need to continue improving in,
Hmm.
especially for individuals once they turn 18.
Yeah, tell me more about that. What would you like to see happen?
Everything.
Okay.
No, it is wonderful. We have some great, there have definitely been um, some great strides and improvements for, I would say, individuals of all ages, but
Hmm.
I would love to see more um, support groups for individuals who are over 18. Part of it is because if you think about it, right, and it doesn't have to be a support group in the sense of necessarily intensity as
Hmm.
much as like there's a group that people who I feel like I relate with who maybe
Yeah.
have access to tools that I didn't know anything about. Well, even through that word of mouth, hearing
Hmm.
it from someone else who experiences things similarly to you, in and of itself can feel supportive. But so often I see across, especially when I speak with individuals who are on the spectrum or autistic, depending on how they describe themselves, and
Yeah.
individuals diagnosed with ADHD,
Hmm.
they oftentimes feel like once they hit 18, 19, they don't have a lot of resources and or there is so much and it's what's the accurate thing or what do I actually access? And it's almost
Hmm.
inundated.
Yeah.
And so I think definitely some of those more local, um, support type groups or systems that let them feel like they can connect, but also
Hmm.
some better, and I say better, but more easy to find advocacy types
Yes. Easier to
groups or
access.
people. Because
Yeah.
I think advocating, it's hard to advocate when you don't know it's something you can advocate for, and
Sure.
it's scary. It's
Yeah,
scary to
absolutely.
self-advocate, and so I think having those things, just to name two, would be a great
I
tool
love that.
that we can continue supporting as professionals, but also as a community for
Yeah.
our other individuals who are with us.
Yeah, yeah, absolutely. I completely agree with you. I mean, you think about when you turn 18, and particularly, well, not particularly, but I work with a lot of, and I have, two kids that are ADHD, and when they turn 18, fabulous things happen, right? But they're still, 18, and in some
Yep.
ways, when you factor in the ADHD and the 3 to 5 year developmental delay, in a lot of ways they may be 14, and so, you know,
Yes.
they're going to go to college, and when they get to college, there's a lot that's happening. And, if they're not able to
Yes.
advocate for themselves, and I think at the college level too, no matter, lots of colleges do incredible jobs, providing a bunch of different supports, but it can be
Mhm.
confusing to navigate, even as a provider, trying to figure out exactly what I need to send. And I'm sure you've experienced this too, what I need to send to validate a diagnosis or to help create a plan, and oftentimes people don't know what they need access to. But I love what you said about just that sense of community, and knowing that you're not alone, because I think that makes more of a difference than anything, even if you just like hang out and talk about, I'm okay, you're okay. And in this moment, we're both okay. And that's
Yep.
cool. I love that.
Yeah. Yeah, and and you had a good point. I'm a professor at one of the universities in the state of Kansas, and one of the things that I often have students reach out about is like, hey, I'm having a hard time, and I'm like, hey, have you reached out to so and so? And I help them start the navigation process, and I can't be deeply involved
Sure.
a lot of times, but at least getting them in the direction because again, they don't know where to start, and
Yeah.
it's the idea of we want you to be successful and it doesn't have to be this much of a struggle. And
Hmm.
clearly it is. So, how do you head them and help them guide on that path so that they
Hmm.
can get the resources they need? Because it is hard. It's hard anyways. And then when you have those other things and other variables in place that maybe the neurotypical person doesn't have,
Hmm.
um, it makes it that much more difficult.
Very much so. Very much so. Yeah, and you factor in, rejection sensitive dysphoria and all the things that get in the way, and the anxiety that a lot of us have experienced and a lot of our clients have experienced post COVID. Nobody wants to talk on the phone or go anywhere in person if they don't have to, but sometimes you
Yeah.
have to, and so
Yes.
yeah,
Yeah.
it
Nope.
can be super
Nope. It
challenging.
definitely threw a loop for all of us with that.
Yeah,
So
yeah. Are we good? I know you only had a few minutes until your client came. Do we have a few more minutes?
we got 20, so we're good.
Okay, awesome.
We can do what we
Rock
need.
on then. Sweet. So let's back up a little bit. What brought you to this type of work to begin with? What interested you in doing mental health work?
Yeah. So, uh, as a young child, I wanted to be a veterinarian, and I decided I could not
Aw.
do surgery. So, uh, but I had a lot of friends growing up who had very difficult childhoods. Nothing that they had done, but their upbringing was very difficult. I had many who were in corrections, and even at a very young age, my mom was like, "You were always the caretaker. You
Mm,
always found the people." And I was raised that like you accept people for who they are, and you it doesn't matter. And so, as I transitioned into high school, I took a psychology course, and I was like, "This is very fascinating. I really like it."
mhm,
Um, and then along with, and in conjunction with my friends that were just having a hard time,
mhm,
um, it just, it kind of, it sat well with me. And then I went to college, took a number of courses, and I took abnormal psychology, which diagnostically, and they're looking at changing the name across many of the universities for that. But
yeah.
when you look at diagnostics, and diagnosing, I just thought it was very fascinating, and the human brain and how it works and all the things that are in motion with it are very intriguing to me.
Uh-huh.
And so I was like, this is a very interesting area. And so I started to pursue working in mental health and found that I really found a lot of intrinsic motivation and a lot of joy in not only helping people through their experiences, but also providing them tools and then getting to see them use them when I wasn't there and see them be successful. Because
Yeah.
ideally, I'm not always going to be present because they're not my children, right? They're not the people I'm with. And so
Mhm,
it's like, here are the things that may work for you
mhm.
and try them. And then when they come back and they're like, I didn't have an explosion, like seeing them being so proud, I'm like, that's fantastic.
Yeah.
Like, good. And you could see it in them that, like,
Mhm.
I can see that I am a worthy human being and that I'm worth, and absolutely, and I already knew that, but now
Right.
you get to feel it.
Yeah.
And that was
Powerful.
so gratifying and
Yeah.
so wonderful to see because as one human, take off my therapist hat to another, you want humans to excel,
Of
ideally,
course.
right? And
Yeah.
so it was just very motivating. And then I just stuck with it and just kind of shifted gears as I've grown and learned and
Mhm.
figured out kind of where I wanted to land with it.
Yeah.
So.
That's amazing. How do you take care of yourself? Do you mind if I ask that question?
Absolutely. That is entirely fine. Clinically in the field, and this is an area when I've overseen interns in the past, and even now when I speak with other clinicians who are budding and they're green, um, taking care of yourself is critical. I have seen people burn out before they even start
Mhm.
because while I appreciate and understand the passion, you yourself are a human.
Yeah.
And while we are therapists, we are not precluded from having feelings and being
Fair enough.
overwhelmed. As much as it's wonderful to think that, it's not
No.
realistic. And so I very actively and consciously engage in things that I find meaningful. So for me, going outside, I'm very much an introvert.
What?
I like time alone. It's
Yeah.
actually where I thrive.
Hmm.
So I do a lot of time outside hiking, exploring.
Neat.
Um, finding a lot of time for like self-reflection. So,
Mhm.
being mindful of, because I'm doing a lot of things that are peopling and I love it,
Mhm.
I also know too that having that time for myself is important. And so learning to be okay with saying, hey, I can't add anything else to my schedule this week. Maybe
Mhm.
we could do coffee on a different week. So setting
Yes.
boundaries.
Boundaries are
But
hard.
yep, but
Say
really
no.
engaging in that quiet time for myself and spending out
Yeah.
time outside for me is probably my best self-care,
Treasure.
and
Mhm.
just kind of listening to what I need. So,
Yeah, I love that. I love it. It's hard. It's hard to put yourself first, when you when you do what you do. But it's
yes.
so important, definitely. I'm so glad you shared that. Let's talk a
Yeah.
little bit about the upcoming presentation without giving too much away.
Yes.
What do I think is we were talking to parents for the most part about the process of getting assessed and diagnosed, and it's okay to talk about getting the parent assessed and diagnosed also, because as we know, a lot of ADHD and now autism, we're learning, is genetic. And so what would someone hope to learn, or what would a parent who is thinking about attending want to know about what we're going to be talking about that they may find compelling?
Yeah, so a few things I can think about. One of the big things, and there's diagnostics is so large, and so we
Yeah,
certainly won't touch everything because
sure.
that would take us quite a while.
Hmm.
But I think some of the big areas that I think about, especially for parents of children,
Hmm.
especially small children.
Hmm.
Now, we obviously are still parents of our children when they're older, but for the smaller children, when you go through the diagnostic process,
Hmm.
making sure that the tools being used are valid,
Hmm.
accepted by insurance. So, for instance,
Yeah.
if you know, like, hey, um, let's say you're going in for a diagnostic evaluation for, let's say, ADHD and autism,
Hmm.
making sure that whatever measures are being used are actually going to be one, exploring the criteria for the diagnosis, but
Hmm.
also recognize because certain diagnoses do require
A certain
certain
level,
tools to
right?
be utilized
Yeah.
in order for that diagnosis to stand. And
Hmm.
so, just to, we'll say autism, for instance, in
Hmm.
order to access certain tools, if one of, it's usually 4 to 6 measures, depending on the company,
Uh-huh.
if one of those is not used, they won't accept the criteria, they won't accept the
Oh,
diagnosis.
that's good to
And
know.
so I think talking about, you know, the methods of assessment, talking about maybe which tools could be used, should be used, that might be something they would hear about. Talking about having a well rounded assessment. So, making sure that we're looking at um, perhaps a number of diagnoses because, as we know, sometimes, especially with comorbidity,
Yep.
and also knowing certain diagnoses kind of look like these diagnoses, making sure you're ruling things out or
Ah.
ruling things in
Hmm.
because you do have comorbidity,
Hmm.
but you also have standalones, but making sure that you are actually looking at kind of all directions and all perspectives so that whatever you leave with,
Hmm.
you have a well rounded um, picture of maybe what your child's experiencing at
Hmm.
that moment in their life.
Hmm.
And so I think definitely coming into it knowing I'm going to learn a little bit about assessments, the process, um, maybe some things and questions I should ask
Hmm.
the uh, the diagnostic clinician about, like, what tests are we running? Is it subjective? Is it objective? Is it both?
Hmm.
Maybe questions that you should ask your insurance carrier of when I'm seeking assessment, what things should I be asking for?
Hmm.
So we'll try to touch on a little bit of everything given our time frame, but my
Sure.
hope is that, especially at the end of it, if somebody has questions, because we'll have time to ask and answer at the end,
Hmm.
um, that, that may kind of close some doors for people if they had some left open. They were like, I didn't quite get that. They can get it, and that might help someone else at the same time.
Yeah, no, absolutely, absolutely. So, I mean, obviously, we focus on ADHD because we're a support group for
Yes.
parents of kids with ADHD.
Yep.
And I hear this all the time, and I don't, maybe you do too, and maybe you can talk a little bit to this without kind of giving away the book of your guys' upcoming talk, which is going to also include Dr. Karen Jordan, who is the founder of your office and a
Yes.
fabulous and just really an incredible diagnostician, and she's been doing this for a long time and is very well respected in her field.
Yeah.
But like for lots of people say to me, oh, everybody's got some ADHD, and why would I need to do a full assessment if I know I've got ADHD? I'm sure like I can just go to my primary care person and they can diagnose me with ADHD. I'll just fill out this for ADHD. Why would I want to go and do like a full thing?
Yeah. And I understand why people say that.
Hmm.
I do, I get it. Um, but there's something to be said about going and doing a full diagnostic evaluation. So when I say full diagnostic, without giving it away,
Yeah.
we're looking at not only questionnaires, but also things that look at skills in the moment,
Hmm.
right? And so we're also looking at things like cognition and adaptive living. I mean, we're looking at every aspect of functioning and not just, can you sit still for 5 minutes? And I'm not saying that's what those measures look at, right? So, like,
Right.
I'm just saying that's one thing.
Hmm.
Um, but having that full comprehensive not only gives you truly a full picture, but it also gives you a good baseline. So later on the road, if you are needing to get updated diagnostic evaluations done because your kiddo is now going to college, or maybe you yourself have been diagnosed and you are going to do X, Y, and Z,
Uh-huh.
you have a baseline to figure out kind of what's changed, what's
Hmm.
shifted, because as humans, we do that frequently.
Yes.
Um, But it's very well rounded, and it's looking at the diagnosis or potential diagnosis from multiple angles and not just a single questionnaire, because the downside with that is like I mentioned earlier too,
Yeah.
is that sometimes like you can answer things and not saying it's not ADHD,
Mhm.
but let's say you're answering these questions about not paying attention and it's actually better explained by anxiety. If they're treating you medication wise
Yeah.
with for ADHD, it's not going to touch the anxiety.
Right. May make it worse, right?
It could make it worse. And so it really lets you get a true picture
Hmm.
of what am I experiencing. And again, if it's ADHD, great. Then you can go to your doctor and help get medication to, if that's the route you're going to go, to
Hmm.
specifically address those symptoms.
Yeah.
Maybe it's comorbid and it is anxiety and ADHD. Well, then that could give the prescribing doctor, whether it's a psychiatrist or a registered nurse practitioner,
Sure.
whomever,
Hmm.
better sense of how are we going to hit this and explore this so that one, we're doing minimally invasive type of intervention,
Hmm.
and two, best supporting this human so that they feel good.
Yeah, that makes sense. And ADHD is one that, like, you rarely just have a diagnosis of ADHD. Correct me if I'm wrong, but usually there's something else too,
It's
right?
some, I don't know, so to be honest, I don't know percentage wise the
Hmm.
frequency of the comorbidity right now with those rates.
Yeah.
I would say it is not uncommon at all to have comorbid diagnoses, but I
Hmm.
have also seen some that it really is standalone to
Just
start.
ADHD. Yeah.
And as the ADHD is addressed down the road, sometimes other things then come
Uh,
to the forefront. But
mhm.
initially, ADHD may be the best explanation as to why the person is experiencing what they're
Mhm.
experiencing.
Perfect. And you wouldn't know that unless you came and got everything else ruled out, right? So,
Exactly, or potentially ruled in, and then
yeah.
that prescriber can say, let's target this first based on the symptoms that you're describing.
Hmm.
Let's explore it, and then if we need to add, we can. But rather than putting in too much at once, let's see if this actually mitigates majority of the symptoms and makes it tolerable.
Hmm. I love that. That's great. Yay. I
Yeah.
can't wait. Awesome. Is there anything that you want to share today that we've not already talked about or touched on, either about the work that you do or the upcoming presentation that people would be
No,
interested to hear?
I think we got some good like information out there. I'm excited for people to come. I'm excited to chat with people and answer questions. Definitely plan to come with questions. And again, we're happy. Dr. Jordan and I are both happy to answer them as they come up. But really, just happy to share the information because, as you mentioned, and as I mentioned, like
Mhm.
diagnostics can do so much for people as far as kind of giving answers and helping guide and direct. But it is a complex area, and there's so much information out there. And so I'm excited to be able to share some of that knowledge, and hopefully, even if it's just to help guide people on kind
Mhm.
of the what do I do next.
Yeah.
Fantastic.
I love it. Thank you. And we're so excited that you guys are willing to do this for our group. And I mean, I know it takes time out of your day and it's a lot to put together. And, the meeting is next month. It's October, I believe, 8th.
Hmm.
Yep, a Tuesday at 6:30 p.m. And we're going to be at a new location for us. It'll be at the Kansas City Girls Prep Academy. And the address is on our website. If you can't come in person, you can also attend online. But I do recommend coming in person because you just get a little something more out of it, I think. But we will be broadcasting online at the same time. Although sometimes it's not the best picture because I end up holding my phone as the camera. So if you want to have non-shaky, like in-person video, then you probably just want to show up and be there yourself. But
There.
thank you so much for being here today and giving us a chance to talk to you and kind of preview what's coming up. October is ADHD Awareness Month, so that's exciting as well, since we're going to be talking about diagnosis and all the fun things that go along with that. Thank you so much for being here.
Thank you, Jeremy, for having me, and I look forward to seeing you all. And we'll see you actually very soon. So,
Yay! Awesome. Thanks so much.
all
I'm
right,
gonna
bye, guys.
thanks. I'm gonna stop the recording.
Okay.